7:39 now. As the cost of nearly everything continues to rise, many families are feeling the squeeze when it comes to health care. The Center for Economic and Policy Research shows the median working family spends nearly $4,000 a year on health care premiums and out-of-pocket costs. That means families are often forced to make some tough decisions about when and how they seek care. Joining us this morning to talk more about this is CEPR Policy Coordinator Brandon Novick. Good morning to you. Thanks for being with us.
Good morning. Thank you for having me.
Your reporting, you found some families are spending more than 10% of their income on health care. Talk about what that burden looks like for a lot of families in real life.
Well, what it practically means is a lot of people are foregoing care because the prices are continuing to rise. And this is not a problem that is just now. There's a lot of coverage of the recent moves by Congress and the Trump administration that have removed access to healthcare for millions of people. But healthcare prices have been going up way faster than inflation for the last several decades. So it's a problem that American families have experienced and are going to continue to experience. And it's not going to go away unless we address the root causes.
Yeah, and you talked about, these costs causing a lot of people to delay doctor's visits, medications, simply because they can't afford it. Talk about the consequences of that and of delaying important care.
Well, when you delay important care, people's health situations don't magically get better. They often get worse. And that could actually increase costs in the long run because then people need more extensive, more comprehensive care that take up more resources. So we really want healthcare prices to be lower so people can go to the doctor, get preventative care, and then not reach far more dire situations.
When it comes to policy, what do you believe that the solution is here to curb these rising costs for a lot of families?
Well, the root causes of our high prices are really systemic. We have consolidation where we have hospitals and hospital systems that are basically monopolies that restrict access to care, increase prices, reduce quality. We have patents, which mean that our medicines and devices have prices that are so insanely high that they aren't needed for innovation or research and development. We know these drug companies spend more on paying their shareholders and buying back their own stock. We have insurance companies which are so bloated and inefficient that we have way higher administrative costs. So to actually reduce healthcare prices, we need to address these systemic issues. But the problem is that our government is not like an honest system with lawmakers with different ideas. It is often bought by the same interests that profit off the system, the hospital lobbies, the insurance lobby, the drug makers. And so as long as they can buy government with lobbying and campaign cash, we're going to have a trouble fixing this. So for solutions, we need to, one, get money out of politics and make it easier, but then we need to break up these monopolies. We need to negotiate drug prices at the very least, and we should ensure everyone has health care coverage through a universal system like Medicare for all.
All right. Brandon Novick with the Center for Economic Policy and Research, certainly an important conversation, one that will continue to go on for quite some time. Thank you so much for your time.
Thank you.